Hello, everyone, and welcome to Health Journey. Today, my topic is if you wake up with dry mouth, your body is warning you. You open your eyes and your mouth feels like cotton, tongue sticks to the roof, lips crack, that thick, sticky saliva that barely moves. Most people dismiss it. I slept with my mouth open. I didn't drink enough water. It's just getting older. That dismissal is a mistake. Your body does not create persistent morning dryness for no reason. It is a signal from salivary glands, airways, fluid balance, nerves, and sometimes deeper disease processes. This is not minor discomfort. It is data. Ignore it and the damage accumulates in silence, teeth, gums, sleep quality, blood pressure, metabolism, energy. For the next half hour, we will break this down completely. How saliva actually works, why production crashes at night, the real causes that go far beyond simple dehydration, the medical facts that challenge common myths, the long-term consequences that hit hard if you keep ignoring the signal, and the precise actions that let you take control starting today. No fluff, no soft language, just the science of how your body works and what happens when you refuse to listen. How saliva really works, and why night changes. Everything saliva is not just spit. It is a complex protective fluid produced mainly by three pairs of major glands, the parotid, submandibular, and sublingual glands, plus hundreds of minor glands scattered in the mouth lining. A healthy adult produces roughly 0.5 to 1.5 liters of saliva every 24 hours. About 99.5% is water. The rest contains electrolytes, enzymes, proteins, antibodies, and buffering agents that keep the mouth's pH stable. Saliva does critical jobs every minute you are awake. It lubricates so you can speak and swallow without friction. It begins digestion of starches. It washes away food debris and bacteria. It neutralizes acids produced by those bacteria so they cannot dissolve tooth enamel. It delivers minerals that help repair early enamel damage. It carries antimicrobial compounds that limit fungal and bacterial overgrowth. Without adequate saliva, the mouth becomes an ideal environment for decay, inflammation, and infection. Production is not constant. It follows a circadian rhythm. Flow is higher during the day when you are eating, talking, and moving. It drops sharply during sleep. Unstimulated flow at night can fall to a fraction of daytime rates. That is normal biology. The problem starts when the nighttime drop becomes extreme or when something actively dries the mouth further. Then you wake with the sensation that your mouth has turned into a desert. Airflow is the silent multiplier. Your nose is designed to warm, humidify, and filter every breath. When air moves through the mouth instead, it evaporates moisture rapidly. Studies show that mouth breathing can strip saliva from oral surfaces in under 10 minutes. Combine that with the natural nighttime reduction in gland activity, and the result is classic morning xerostomia, the medical term for dry mouth. The real causes, far beyond not enough water. Dehydration contributes, but it is often overstated. When researchers measure actual overnight fluid loss, pure volume depletion explains only a minority of persistent morning dry mouth cases. The dominant drivers are mechanical, pharmacological, and systemic. Mouth breathing during sleep is one of the most common. Nasal congestion from allergies, a cold, sinus issues, a deviated septum, or enlarged tissues forces the body to switch to oral breathing. Air flows directly across the tongue and soft tissues. Moisture vanishes. Habitual mouth breathing can continue even after congestion clears, becoming a learned pattern that dries the mouth every night. Obstructive sleep apnea elevates the risk dramatically. In this condition, the soft tissues of the throat collapse repeatedly, blocking airflow. The body responds by gasping and switching to mouth breathing. Research shows people with moderate obstructive sleep apnea have roughly 2.8 times higher odds of waking with dry mouth compared with controls. In some clinical samples, 60 to 89% of patients with increasing severity of apnea report morning dryness. One study found dry mouth on awakening in 60% of mild cases, 73% of moderate, and 89% of severe cases. The more severe the oxygen drops, and the longer the time spent with low oxygen saturation, the worse the dryness often becomes. Salivary flow rates can fall, and saliva pH can become more acidic as apnea severity increases. This is not just an oral problem. Every apnea event spikes blood pressure, fragments sleep architecture, and drives systemic inflammation. Morning dry mouth is frequently one of the earliest visible clues that the airway is failing while you sleep. Medications are another major driver, and one of the most overlooked. More than 1,000 prescription and over-the-counter drugs list reduced salivary flow as a side effect. Common classes include antidepressants, especially older tricyclics and some SNRIs, antihistamines, decongestants, blood pressure medications, including certain ACE inhibitors, beta blockers, and diuretics, muscle relaxants, opioids, and drugs for overactive bladder. The mechanism is often anticholinergic. These drugs block muscarinic receptors that acetylcholine needs to stimulate the salivary glands. Without that signal, the glands produce less fluid. Polypharmacy makes the problem worse. Older adults taking 5 or more medications face dramatically elevated risk, in some data nearly tenfold. Many people never connect their daily pills to the dry mouth they wake with every morning. Diabetes links dry mouth to metabolic dysfunction. High blood sugar pulls water from tissues through osmotic diuresis. The kidneys dump excess glucose and water into urine. This creates whole body dehydration that reduces saliva volume. Nerve damage from chronic hyperglycemia can also impair the signals that tell glands to secrete. Dry mouth appears in a substantial percentage of people with diabetes and can be an early warning sign of poor control or undiagnosed disease. Sjogren's disease is an autoimmune attack on the moisture-producing glands themselves. The immune system targets the salivary and tear glands, leading to progressive fibrosis and permanent reduction in output. Dry mouth and dry eyes are the hallmark symptoms. It is far more common in women and often appears after age 40. Left unrecognized, it drives severe dental destruction and reduces quality of life. Other contributors include radiation therapy to the head and neck, which can permanently damage glands, certain neurological conditions, tobacco use, and simply the cumulative effect of aging combined with medications and comorbidities. Age itself does not destroy salivary glands. The medications and diseases that become more common with age do. Shocking medical facts that challenge everyday assumptions. Saliva is one of the body's most effective natural defenses against tooth decay. When flow drops, the oral pH falls, acid-producing bacteria multiply, and mineral loss from enamel accelerates. People with chronic xerostomia develop cavities at higher rates, often in unusual places such as the root surfaces or along the gum line. Restorations fail earlier. Gum inflammation and periodontitis risk rise because plaque is not cleared effectively. In sleep apnea, the combination of mouth breathing and reduced saliva creates a perfect storm for oral disease, while the rest of the body pays a cardiovascular price. Untreated, moderate to severe apnea is linked to hypertension, atrial fibrillation, heart failure, stroke, and higher mortality. The dry mouth is not the disease, it is the visible tip of a systemic problem. Medication-induced dryness is frequently accepted as inevitable. It is not. In many cases, a clinician can adjust the drug, change the timing, or switch to an alternative with lower anticholinergic burden. Yet millions of people simply adapt to the cotton mouth sensation and never ask. The myth that everyone wakes up dry sometimes hides the difference between occasional mild dryness and persistent severe xerostomia that signals pathology. When dryness is constant, accompanied by thick, stringy saliva, difficulty swallowing dry food, burning sensations, or cracked lips, the body is no longer functioning within normal limits. The consequences. What happens when the warning is ignored? Oral tissues take the first and most visible hit. Without saliva, the mouth becomes a high-risk environment. Cavities form faster and in more locations. Gums bleed and recede. Teeth loosen. Oral thrush, candida overgrowth, becomes common. Bad breath persists despite brushing. Taste changes. Speaking and swallowing grow effortful. Dentures, if present, lose retention and cause sores. Over years, this can lead to tooth loss, expensive restorative work, and chronic oral pain. If sleep apnea is the driver, the systemic toll grows. Sleep never reaches deep restorative stages. Daytime fatigue becomes chronic. Concentration and memory suffer. Mood can darken. Blood pressure remains elevated through the night and into the day. The heart works against repeated oxygen desaturations and sympathetic surges. Inflammation rises. The risk of serious cardiovascular events climbs. In uncontrolled diabetes, the cycle reinforces itself. High sugar worsens dehydration and dry mouth. Dry mouth and poor oral health can further complicate metabolic control. Nerve and vessel damage accelerate. In Sjogren's or post-radiation cases, the dryness can become permanent. Quality of life drops sharply. Eating becomes a chore. Social interactions grow uncomfortable. Depression risk rises. These outcomes do not appear overnight. They build from the same nightly pattern: reduced saliva, mouth breathing, medication effects, or systemic disease, repeated hundreds of times. Small daily choices and ignored signals compound into irreversible tissue and organ damage, or they can be interrupted early. The mindset shift and what to do. Starting today, stop treating morning dry mouth as an annoyance or an inevitable part of aging. Treat it as functional information from your salivary system, airway, and fluid regulation. Practical steps are concrete. If you wake up with dry mouth, your body is warning you. Section 1. The hook. You wake up. Your mouth feels like sandpaper. Tongue sticks to the roof. Lips crack. You shrug it off. I slept with my mouth open. I just need water. That is the lie most people tell themselves. Your body does not waste signals. A dry mouth every morning is not normal. It is a warning that saliva production failed overnight, air is drying your tissues, or something deeper is disrupting the system. Ignore it, and the damage starts in the mouth, then spreads. Section 2. How your body really works while you sleep. Saliva is not just spit. It is your mouth's first line of defense. It neutralizes acids from bacteria. It washes food particles away. It keeps enamel hard and tissues soft. It even contains antimicrobial compounds that fight infection. During sleep, saliva flow naturally drops. That is expected. But when dryness hits hard every single morning, the drop is too extreme. Your nose is built to humidify and filter every breath. Mouth breathing bypasses that system completely. Air races across the tongue and soft palate. Moisture evaporates fast, often within minutes. The salivary glands cannot keep pace. By morning, the mouth is dry, sticky, and vulnerable. This pattern frequently links to nasal congestion, allergies, a deviated septum, or repeated airway collapse during sleep. The body is forced to switch to mouth breathing just to get air. Section 3. 3 shocking medical truths. Truth 1. Chronic dry mouth multiplies dental destruction. Without saliva, acids stay longer on teeth. Bacteria multiply faster. Cavities form quicker. Gum disease advances. Oral thrush becomes more common. Studies show people with persistent xerostomia face dramatically higher rates of tooth decay and periodontal problems. Truth 2. Sleep apnea and dry mouth are tightly linked. People with moderate obstructive sleep apnea have nearly 3 times higher odds of waking with dry mouth. Up to 70% of those with the condition report it regularly. The airway collapses, breathing pauses, the body switches to mouth breathing, and saliva dries out. Untreated, this same disorder raises risks of high blood pressure, heart disease, stroke, and chronic fatigue. Truth 3. Medications are a major hidden driver. More than 1,000 drugs, antihistamines, antidepressants, blood pressure medications, diuretics, muscle relaxants, and many over-the-counter options reduce saliva by interfering with the nerves that stimulate the glands. In clinical data, medications account for roughly 1 in 3 cases of dry mouth. Aging alone is rarely the sole cause. Polypharmacy and underlying conditions amplify the effect. Dehydration plays a role, but pure volume depletion explains only a minority of persistent morning cases. Section 4. The real cost of ignoring the signal. Leave the dryness unchecked and the mouth becomes an open invitation to problems. Tooth enamel softens, gums inflame and bleed. Bad breath becomes constant. Swallowing and speaking feel harder. Sores and infections appear. Dentures, if worn, stop fitting comfortably. If sleep-disordered breathing is the root, the consequences escalate. Fragmented sleep, morning headaches, daytime exhaustion, rising cardiovascular strain, and higher long-term risk of heart attack and stroke. If elevated blood sugar is involved, dry mouth can be an early marker of diabetes quietly stressing kidneys, nerves, and vessels. Everyday habits accelerate the damage, sleeping with the mouth open night after night, relying on mouth breathing because the nose is blocked, taking multiple saliva-suppressing medications without review, or assuming water alone will fix everything. Small nightly failures compound into irreversible oral destruction and systemic health decline. Section 5. The mindset shift and call to action. Stop calling it just dry mouth. Call it what it is, a measurable signal from your salivary glands, airway, and metabolic systems. Act on the data. Drink water consistently through the day so overnight reserves are not depleted. Address nasal congestion aggressively, allergies, structural issues, or nighttime blockage. Observe whether you snore, gasp, or wake unrefreshed. Review every medication and supplement with a clinician to identify saliva reducers. Seek evaluation for sleep apnea if the pattern is daily and paired with fatigue or loud breathing. Protect the mouth in the meantime. Sugar-free gum or lozenges that stimulate saliva, a bedside humidifier, and strict oral hygiene. Your body has already spoken. The dry mouth is the warning. Respond today, while the teeth, the airway, and the rest of the system can still recover, or keep paying later with pain, disease, and lost quality of life. The choice is yours every morning you wake up.